everyone, and welcome to section 2 of chapter 20, the reproductive system. Here's where we take a beginning dive into the female reproductive system by taking a look at the structural parts. So, the female reproductive system is composed of paired ovaries, which are the female gonads, similar to the testes in males, paired fallopian tubes, a uterus, a vagina, and external genitalia. If we look at the ovaries in and of themselves, as mentioned, these are the female gonads or the female reproductive organs. The reason being, these produce the egg, or 50% of what would become offspring. They're paired glands, about 1.5 inches long, and they're found on either side of the uterus within the pelvic cavities. So these are going to be lateral to the uterus. An ovarian ligament exists and extends from the medial side to the uterine wall. And really, this is just a fold of peritoneum known as the broad ligament. Its purpose is to cover the ovaries and to make sure that they are held in place. That way, normal daily movement functions don't jostle them inside that pelvic cavity, since there's no direct attachment to the fallopian tubes, which we'll see in a bit. The ovaries, as mentioned, function in the production of the ova or the egg, as well as the female sex hormones, estrogen and progesterone, estrogen being our primary hormone. At birth, about 700,000 primary follicles are available to an individual female. And again, this is average. However, no female is experiencing 700,000 periods, which means that only about 300 to 400 of those will mature into ova or egg during a female's childbearing years, which range from the start of puberty all the way to menopause, which is the end of the menstrual cycle. Taking a look at those fallopian tubes, as I mentioned, these are called oviducts. So ovi meaning egg, duct, tube. So this is the tube that the egg's going to travel. In fact, it's about 4 inches long. The lateral end is going to enclose the ovary with these fringe-like projections known as fimbriae. The fimbriae work similar to that of cilia or flagella in the sense of they produce movement. And the movement they produce is meant to pull the ovum or the egg into that fallopian tube so it can travel along its normal path and normal journey, because the fimbriae aren't immediately attached to the ovary, even though it might look like that in this diagram. The medial end of the fallopian tube will open up into then the uterus. The fallopian tubes are overly important because this is where fertilization occurs. It does not happen in the ovary, and it doesn't happen as late as the uterus. The fallopian tubes and fertilization typically come together and happen within 24 to 48 hours after sexual intercourse. So I'm assuming you've seen the Plan B commercials that are on TV. This is the reason why they say in those commercials that one would need to take the pill within the first 24 to 72 hours after intercourse. Because if the fertilized egg moves along into the uterus, it will embed itself into the uterine wall and then eventually become not just a zygote, a fertilized egg, but a full-blown offspring. However, good news is this process takes about 4 to 5 days, which is why the Plan B commercials give you that range of within the first 24 to 72 hours after sex. If the fertilized egg doesn't make its way to the uterus and instead continues to develop in the fallopian tube, it is known as an ectopic pregnancy. An ectopic pregnancy is a fancy way of saying it's a pregnancy in an abnormal site. Unfortunately, this could be very problematic for the female if they don't recognize signs and symptoms that something is not right. If it develops large enough, then it could rupture the fallopian tube, create internal bleeding, which might risk the sterilization of that female. So if ever you feel like you've missed your menstrual cycle or things don't feel right, you need to go get checked out. You need to go see a doctor, or you need to go grab a pregnancy test to make sure you're taking care of your body. The uterus is about 3 inches in length and about 2 inches wide, and the lower end will narrow into the nice circular muscle, which is known as the cervix. The cervix is responsible for a majority of the pain in childbirth, and we'll see that in a couple of days, because this has to open up to allow the offspring out of the uterus and then through the vagina. The cervix, therefore, opens up into the vagina. So if you look at the diagram, it kind of bottlenecks at the cervix, and then that tube down at the bottom being the vagina. The uterus is located within the pelvic cavity, superior to the urinary bladder. So this is also the reason why most pregnant women can't hold their urine quite as long, because as that uterus expands with the growth of offspring, well, offspring are sitting on the bladder and cause mom to need to go use the restroom more regularly. The uterus is also covered by that broad ligament, so it's going to make sure that it doesn't get jostled within that pelvic cavity, similar to that of the ovaries. The uterus is important because where the fallopian tube we saw fertilization, the uterus is where we see fetal development, and it's also where labor is going to begin for mom. The vagina is also muscular in structure, and it's a muscular tube about 4 inches long. It extends from that bottleneck cervix all the way out to the vaginal orifice or the vaginal opening. It's posterior to the urethra and anterior to the rectum. So here, when we're using these anatomical terms, we are very much talking when someone is standing in anatomical position. So upright, feet slightly apart, palms facing forward. That is what we're referring to. Those terms would obviously change if one was in the laying down position. The vagina functions as a passageway for a multitude of things. Menstrual flow during the menstrual cycle. It also receives the penis during intercourse, and it eventually becomes the birth canal, should that be a course a female chooses, during the birthing process. The vagina on the exterior has a thin membrane known as the hymen, and it's meant to protect and cover the vaginal opening. Therefore, nothing harmful enters the female reproductive system or the female body as a whole. The hymen can break relatively easily during things such as intercourse, activity, or things like insertion of a tampon. So it's a myth to say that a broken hymen means that that individual is no longer a virgin. Instead, this can be broken from a little girl learning to ride her bike who falls off and unfortunately hits that nice bar that connects the front of the bike to the back of the bike, or a little girl that's into gymnastics and falls on the horizontal beam, so on and so forth. The external genitalia as a whole of the female is known as the vulva or the udendum. This includes things like the labia majora, labia minora, clitoris, Bartholin's gland, as well as what we'll see in a couple of slides, the mons pubis. The clitoris is a small mass of erectile tissue anterior to the urethral opening, so in front of when we're standing in anatomical position, and its only function is sensory, no motor function, and it becomes more active during stimulation simply because it's relatively similar to that of the penis, meaning it's got vascular sinuses which will fill with blood, and the clitoris will become more enlarged and therefore more sensitive during any type of touch. The labia majora and labia minora are covered when standing in an anatomical position from what I mentioned before, the mons pubis. The mons pubis is a pad of fatty tissue that sits anterior to the pubic symphysis. So that lower portion of the pelvic bone, we have an additional layer of protection. The best example I can kind of give is that kind of quintessential image one would have of someone playing kickball or softball and a ball coming really fast and hitting in the lower groin-like area. This mons pubis is meant to protect then the reproductive organs found posterior to it, including things like the labia majora and the labia minora. The labia majora are categorized as being lateral to that of the medial minora, and these are paired folds of skin that cover the vaginal opening, In layman's terms, they're often referred to as lips. So the large lips, the small lips. Within them, there's an area known as the vestibule. The vestibule is really important because this prevents the drying out of the mucous membrane. The mucous membrane is really important to keep normal feminine health for each individual. We're talking lubrication as well as normal pH balance in this area of the female body. Within this area, we also have the Bartholin's gland, also known as the vestibular gland. It has ducts which open into the mucosa at the vaginal orifice, and these are important to secrete mucosa to keep the vaginal orifice lubricated during intercourse, simply because it would be relatively painful if this area was not lubricated, and if sexual intercourse was painful, the argument would be it would never take place. And if it never took place, we would not create offspring. Our entire species would then die out. A yeast infection is something a female can experience in this area of the body, and it's a vaginal infection caused by, well, yeast, and yeast is a fungal organism. This can happen due to an increased amount of heat or moisture in the area, allergic reactions to the detergent you're wearing or soaps, hormonal fluxes depending on your time of menstrual cycle or the time in your life, injury, and sexual intercourse, just to name a few. Symptoms include things like a thick and malodorous discharge from the vaginal orifice, labial and vaginal itching, and painful urination. In essence, if your area or your vaginal area does not feel well, it feels like there's something wrong, then you need to go see someone. Or there's a lot of over-the-counter type of medicines that can help cure this for the individual. Similar to the male's prostate exam, females have to experience a pelvic exam. This is an examination of the internal female reproductive organs, and it's usually known as a pap smear. In a pap smear, cells are scraped from the cervix and examined to detect cervical cancer. So there you see in the pictures off to the side, a woman with her feet in what they refer to as stirrups. You then have that metal device that kind of looks like a duck. It's known as a speculum. It's inserted into the vaginal orifice and vagina, and then it's opened, as you can see. That way, that nice stick-looking thing at the bottom can be inserted, and it can scrape those cells. That way, they can be examined to check and detect for cervical cancer. And last but not least, similar to that of a self-testicular exam for men, we've got self-breast examination for females. Monthly breast self-exams are recommended after the menstrual cycle stops, and this always should include a visual. You're trying to note any changes in contour or texture or sometimes even color to the breast area. Manual examination usually should take place in the standing or reclining positions. As you can see in the diagram off to the side, there are multiple ways in which you are suggested to move your hands to check or palpitate the tissue to see if there are any lumps. And you're trying to note those. Or if there's been a change, maybe you have a benign mass of cells that you've had your whole life, but unfortunately it's getting bigger. That's something to note and go to your doctor with. So this is the beginning of the female reproductive system. We're going to continue to move forward because we get to talk about things like the menstrual cycle and pregnancy and then childbirth. So if you have any questions, please let me know. Otherwise, have a great day and I'll see you next class.